Well, thanks very much for coming, everyone. It's good to have you here. In the next 10 minutes, because we're meant to be brief here, we're going to review some thoughts that I have on the importance of a new discipline that isn't taught as much in medical school, one that is part of our curriculum certainly, but one where I think we can do better. And so I thought I would set this up by showing you a picture of Hippocrates, and I'm going to wander over here because I've been told to do so to the other side of the screen. So you'll recognize Hippocrates, of course, right? Which do you think is Hippocrates? All right, so Hippocrates is the guy on the left, of course. And we take the Hippocratic Oath, the modern Hippocratic Oath as physicians among our colleagues. But in the beginning, the older Hippocratic Oath, the ancient Hippocratic Oath, was made to Apollo and Hygienia and Panacea, several Greek gods that we no longer, I think most of us, worship. The new kind of scion of modern healthcare is a fellow on the right, and in the modern era of healthcare reform, certainly in the United States and I think across the world, this individual is recognized as the person who invented the so-called triple aim of healthcare. Now, does anybody know this person's name? Raise your hand. We're mic'd. Not surprisingly, you don't. Well, one of you does, and that's good to see, actually. You're now part of the Faculty of Health Policy. But this fellow's name is Don Berwick. He, by his tie, as you can see, is a pediatrician. And Don Berwick is from Boston, and he has a long-standing history of excellence in healthcare policy, and is certainly recognized as recently the person that implemented Obamacare in the United States. But really, he's been involved in healthcare and the concepts leading to modern healthcare for over 20 years, since the late 1980s. He's the founder of the IHI, the Healthcare Institute, and he basically invented this concept, the triple aim, which is access to care, quality, and sustainability. All right? So whether you're in Canada or the United Kingdom or the United States, any modern healthcare system knows about the triple aim and is trying to accomplish that triple aim. And I would have to say that in the modern era, this is potentially mythology because it may not be attainable, but it's the goal of almost every healthcare system in the modern developed world. So, two people you should know by sight, Hippocrates on the left and Don Berwick on the right. If I can get the next slide, please. Now, my premise today for you is that our medical students, and in fact all health profession students, should know as much about health policy as they do about medicine, clinical medicine. We are, in fact, intentionally suggesting that we actually shake hands with the roots of medicine, Hippocrates, and modern healthcare, with health policy being the centerpiece of that relationship. Why is that so important? Well, the next slide, and the only other slide I have for you, is an illustration of two widely read journals, one with an impact score of 53.5, which is high, I can assure you, and one with an impact score of 3.8, which is pretty good, but not stratospheric. The New England Journal of Medicine, I'm sure all of the faculty and most of the students read the New England Journal of Medicine online or in paper, and I think that most of you don't read Health Affairs. These are two very different journals, obviously read by people interested in health policy, people interested in health policy and clinical medicine. So it wouldn't be fair to say that the New England Journal of Medicine doesn't in any way deal with health policy. It certainly does. But that being said, my premise is that a 14-fold difference in their impact is an unhealthy difference in their impact, and that all of our students should be reading, if they're reading two journals, it should be the New England Journal of Medicine and Health Affairs. Why do I say that? Because, as I'll try to make the case, the information in this side of the slide is as important as the information on the pages of the New England Journal of Medicine. And how many of you have read an article from Health Affairs? Raise your hands. So good to see that once again, the person that knew the answer to Don Berwick also raised his hand. And there's an R value there that I'd like to explore later on. So why did we get interested in this area? Well, I'll tell you what, it's data-driven. When I was working as the Petersdorf Scholar in Washington, D.C., near the Kennedy Center, as a matter of fact, I'd go by it almost every day, we were looking at the so-called graduate questionnaire data, and we're trying to figure out why students went into different types of careers. Why did they go into primary care? Why did they choose specialty care? Was the economy involved? Was health policy part of their decision making? And we examined the last 10-year history of the graduate questionnaire in the United States and Canada, and along with other colleagues that were working in a similar fashion, including people like Mitesh Patel, who has published his work in the New England Journal of Medicine, we came to see that very quickly that while 90% of students in the US and Canada were very happy or satisfied with their clinical education, less than 50% were happy with or satisfied with their health policy and public health education. Now that's a very low number, and it's a number that's been, as I say, published by Mitesh Patel in the New England Journal of Medicine in 2010, and we've started to look at what it is that causes that to occur. Why is it that we're so good at teaching clinical medicine and so poor, it seems, in the eyes of our students, 100,000 students, in teaching health policy and related concepts? And so this is the basis for some work that we're publishing, and we've got a couple of papers coming up. But the point of the matter is that we believe we're coming to understand that not only do we do this poorly, but our students recognize that we do it poorly. And when I meet with our students here, I hear all the time that they'd like to learn more about health policy. And I ask them, why is that? And that gets to the crux of what I'm here to talk about, perhaps with you in the last few minutes. To be a complete physician, myself, my colleagues who are already physicians, and our students believe you need a strong knowledge in clinical medicine, but you also need to be able to be an advocate for your patient. How can you be an advocate for your patient in a complex, changing health system if you don't understand how the health system works? How can you understand the drivers and the results, the inputs and the outcomes of healthcare? How can you actually work the system to the benefit of your patient, which is sometimes what you have to do? How can you accomplish that without understanding really how this works? And I can tell you, having served as a dean for nearly 5 years in the United States, having practiced for 30 years in the US and Canada, it took me a year studying this in Washington, D.C. to really understand how healthcare works, how the funds flow, why the access is limited, why the quality isn't perfect, why sustainability, because of the cost increases of healthcare, is always being questioned. So it's important that we all talk about this and we understand it, and we come to a common belief system that clinical medicine is essential, but knowledge of health systems and health policy is equally important. So our equation, if you will, for this, which I put into my submission, was health policy knowledge equals patient care impact and health system sustainability. I firmly believe that the next generation of physicians, by knowing more about health policy, will help us to sustain our healthcare system, hopefully to improve access, hopefully to improve quality, but the sustainability, the very existence of healthcare as we understand it, lies in the hands of our students who will, by understanding the system, allow it to be sustained. Absent that knowledge, I fear, in fact, for the future of healthcare as a system of care, whether it's in the United Kingdom, Canada, or the United States, because we all, as I said earlier, struggle with the same challenges. So who are our advocates? For the system, who are the advocates for the patients? It's the students. And if the students aren't taught the principles that they want to know about how to be an advocate, how are we completing their medical education in a way that's modern, not ancient? So what are we doing about this? We want to lead in this field. We want to be part of a group of leading institutions that advance education in a way that is, I think, appropriate to the needs of society and to the needs of our learners. So we've been working on a curriculum with colleagues from the University of Pennsylvania, Georgia Health Sciences University, the Association of American Medical College, and we are actually in the process of getting ready to implement a curriculum which we call Health Policy for Health Professionals. We will teach this curriculum as an interprofessional education content curriculum to all sorts of healthcare students across this campus, and we will also go online. You can call it a MOOC for MDs if you want to. But we'll make this content available across the world so that people can come to understand that this is important. It's part of the curriculum that is overlooked, undertaught, and a sore spot among students, and has been for 10 years, and we need to do this better. So all I will say in conclusion really is, if you haven't read Health Affairs, pick up a copy. If you want to be part of a team of people that is actually interested in health policy and the advancement of the triple aim, let me know, and we'll convene a working group, a talking group, a sharing group, and we'll come together and talk about this. If it feels important to you, it's important to me. I want us to talk. I want us to have a conversation. And hopefully today, in the last 10 minutes, we've gotten that conversation going here at the University of Alberta. So thank you for coming.